We continue to observe American Heart Month. I went to BR Cardiology Center to speak with cardiologist Dr. LaMotte for his input on what matters most to keep a healthy heart. And he says it's staying active.
This month is dedicated to bringing about awareness about the magnitude and the impact that cardiovascular disease can have in the community. It's been the #1 killer for the past 100 years. And so we've made some strides, some improvement, but there's a long way to go, and still we have a lot to learn.
One thing that stuck out to me is that women, #1 leading cause of death. Am I correct?
That is correct.
And women, why? What's the difference between men and women?
Well, sometimes the manifestation can be a little bit different, and frankly, some women, they're dismissed, because the symptoms may not always be as classic in women. So we've got to do a better job of paying attention to our women, but also women should be proactive and make sure that their providers are listening to them. Statistics show that heart disease kills more people than all forms of cancer combined. Someone has a heart attack every 40 seconds. Someone dies from some form of cardiovascular disease every 34 seconds. If you come from a family of, mostly sedentary people, you may tend to be sedentary. But, the challenge that we like to offer patients is to try to break that. And so you can't change the DNA, but you can change the habits. If you have this, risk profile with this striking family history of particularly young folks having events, then you should get yourself evaluated sooner. You can start certainly with your primary care physician, who can do the very basics. They can do EKGs and assess blood pressure and cholesterol and blood sugar. But, if you have a murmur, if you have problems like with chest pain or shortness of breath, then certainly you need to be bringing that to someone's attention if you have that kind of risk profile. You can get out, you can exercise, you can modify your diet, you can not smoke. And if you have some of these chronic conditions like high blood pressure, high cholesterol, diabetes, that can predispose to heart disease, you can mitigate that by some lifestyle changes.